Hello friends, today's topic of discussion is blood components. So in this class, we are going to discuss what are blood components, what are the various blood components, what are their functions, how are they derived and how are they stored. Okay, so firstly, what are blood components? So they are derived from whole blood. Now, where is this whole blood coming from? This whole blood is when it is donated by a voluntary blood donor. Donated by a voluntary blood donor. So once this whole blood is obtained, how is it converted to blood components, or how the blood components are derived from this whole blood? So let's say that this is the blood bag and we have collected the whole blood here. Okay. Now whole blood undergoes a process called differential centrifugation. What is differential centrifugation? See, centrifugation is that it is rotating at a very high speed, and when I say differential, that means this centrifugation is going to separate out the components on a certain characteristic. So here they are separated based on their specific gravity, based on their weight. So the heaviest ones settle at the bottom and the lightest ones are at the top. So once this differential centrifugation occurs, what are the layers that are formed? So the first layer that is formed is of PRBC. What is this? Packed red blood cells. This is packed red blood cells. Okay. Now these, because the red cells are the heaviest ones, so these settle at the bottommost layer. Now just above them is a layer of buffy coat. This layer, the buffy coat, consists of your white blood cells and your platelets. Okay, so this forms a very thin layer just above the PRBC layer, and this forms your buffy coat. Above this buffy coat is the plasma. Your plasma, the liquid layer. The liquid in which the cells of this buffy coat and this PRBC is suspended otherwise is the plasma, which forms your lightest components and is present at the top. Okay. Now what happens is, now we have this. Now once this bag is ready, we do component separation. How is component separation done? Either by automated separators or by manual component separators. So what happens is, first of all, so these bags are connected with other bags also. So firstly, this plasma bag is taken out into another bag. Then this buffy coat is separated out, and this PRBC usually remains in this bag, and if needed, any additive solution is added in this PRBC. Okay, so now you know how this component separation occurs. Now let's see what are the various types of blood components. So blood components can be divided into two categories. How? The cellular component and the acellular component. So acellular is which does not have any cells. Cellular ones are the cells that are floating in the plasma medium. Okay. So as we saw, the first is PRBC, your red blood cells. First is that. The other from your buffy coat layer is platelets, and another is granulocyte, again derived from your buffy coat layer. Okay, so these are the cellular components primarily. What are your acellular components? So your acellular component is your plasma. Now, plasma can be of various types. So it can be fresh frozen plasma. It can be P24 plasma, that is frozen after 24 hours of collection. Okay, or it can be cryoprecipitate, or it can be cryo poor plasma. So now you see the types of components. We have cellular and acellular, and these are the ones that constitute it. Now what happens is, the first thing that we had was whole blood. Okay, whole blood. Let's talk about it first. So whole blood contains all of these, all the components that we've talked about, and further when this is subjected to differential centrifugation, the components are derived. Okay, now when you're collecting the whole blood, normally when you're collecting the whole blood, you're collecting it in an anticoagulant solution. Okay, why anticoagulant solution? The moment blood comes out of your body, it tends to coagulate. Okay, so if you want to preserve it for a longer time, anticoagulation is necessary. So usually there are two types of anticoagulants that we use. It is either CPD or it is CPDA, right? So what is the difference? So firstly, let's see what is CPD and what is CPDA. So CPD is citrate phosphate dextrose. Citrate phosphate dextrose, and CPDA is again citrate phosphate dextrose, and in addition to it there is adenine. Adenine is for further nutrition. Okay, so what happens is, now I am calling it as anticoagulant solution. So the citrate part is providing you the actual anticoagulation, and the rest of the part is providing nutrition to the whole blood that now has been taken out of the body and requires some kind of external nutrition for it to be preserved for a longer period of time. Okay, now this whole blood, when it is like when the components are separated and PRBC is formed, then there are other various additive solutions that can be added, and one of them is sagum. So what is sagum? This is sodium adenine glucose mannitol. Okay, so this you have to remember. Again, uh, this will uh, this will help in nutrition. So this constitutes only the nutrient component. This will not provide any kind of anticoagulation, right? So coming to the first component, which is our PRBC. So what are we going to learn about all these components? So first will be your shelf life. Then we'll talk about its storage. Okay. So what is the shelf life of PRBC? Again, whatever anticoagulant you are using and whatever nutritive solution, additive solution that you are using is going to determine the shelf life of PRBC. Okay, so the anticoagulants that we have learned so far is CPD, CPDA and sagum. So these are the additive solutions, and here I am writing the shelf life. So if we are keeping it on CPD, the shelf life is 21 days. If adenine is added, it becomes 35 days. And if sagum is also added, then it becomes 42 2 days. So this is one table from which a question can be asked in your exam. So this is the shelf life that you have to remember. Okay. Next is your storage. So first is storage where. So where do you store it? You store it in something called as BBR, which is your blood bank refrigerator. Okay. And storage, two things. First is where and at what temperature. So the temperature is 2 to 6 degrees centigrade. Now the other options that you can get, it will be 2 to 6 degrees centigrade or it would be 4 degrees centigrade. Okay, so both are correct, right? So this is about PRBC. Now you know what is the shelf life. Shelf life will be determined by the additive solution that is added in the PRBC, and storage, you know, it is stored in blood bank refrigerated and the temperature is 4 degrees centigrade. Now why 4 degrees centigrade? This I am telling you so that you remember that it is stored at 4 degrees centigrade. So what happens if the temperature goes below 4 degrees or above 4 degrees? So this is your red cells. These are the organelles which is present, okay, and the rest part is water, okay. So at below 4 degrees centigrade, what happens is the water inside this crystallizes. So if water is crystallizing, it forms needle-like structure. So if you're freezing red cells and then when you're thawing for transfusing it to a patient, what happens is these crystals, they tend to break the red cell membrane, and what happens? Hemolysis occurs. The same thing happens when when the temperature increases. Again, at increased temperature, the membrane becomes fragile and again it is subjected to hemolysis. It breakdowns and hemolysis occurs. So the integrity of red blood cells is not maintained for it to be stored for a longer period of time. Therefore, the desired temperature is 4 degrees centigrade for its storage. Okay. Other thing is at 4 degrees centigrade, the metabolism of PRBC is reduced to a minimal state. So whatever nutrition it is having and whatever nutrition we are providing, that is sufficient for it to survive for a long duration of 35 days or 42 days. Okay, so that's why 4 degrees centigrade has been chosen. Now, having read about PRBC, let's come to the next blood component, which is your platelet. Now for formation of platelets, okay, let's first see its shelf life. So very simple, shelf life of platelet is 5 days, irrespective of the additive solution. Whether you're adding any additive solution or not, the shelf life of platelets is 5 days. Where it is stored? It is stored in an equipment called as platelet incubator and agitator. Okay. Now platelet incubator and agitator, I will tell you why. So incubator means it is being kept at a specific temperature. So what is the temperature? Temperature is room temperature or 22 degrees centigrade or 20 to 24 degrees centigrade, whichever is there in the option, you have to pick and mark it as correct. So these three can be provided in the options. All of these are correct. So incubator, so the temperature of the incubator is maintained at this. Now what about agitator? Why is agitation required? Agitation is required for proper platelet metabolism. So if you keep the platelets static, the oxygen and carbon dioxide exchange which is happening between the bag and the environment will be very less. So agitation is provided so that this oxygenation which is being provided to the platelet is maintained and platelet metabolism is properly carried out. If at all you are keeping it as static and the proper oxygen exchange is not happening, this platelet is going to switch to glycolysis. You know the end product of glycolysis is lactic acid. So the overall pH of platelet is going to decrease. And if at all this pH goes below 6.2, it becomes unfit for transfusion. Okay. So therefore, maintaining platelet metabolism, maintaining the oxygen exchange is very important for platelets to remain viable. Okay, so we have read the shelf life, we have read where it has to be stored, and we have read the temperature and agitation. Now one more thing that you need to know here is how are platelets derived. So we knew that we had the whole blood, we subjected it to differential centrifugation. Now what happens is there are two ways to derive platelets. So one is platelet rich plasma method, which is PRP, and the other is Buffy-Coat method. So as you know, as the name suggests, platelet rich plasma. So first you have to derive a plasma which has excess of platelets, and then from that plasma you have to derive the platelets. So what we do here in this, the whole blood which is there here, the whole blood is subjected to hard spin. Hard spin means it is centrifuged at a higher speed. Okay, higher speed and for a longer duration of time. So no, I'm sorry. First, a soft spin is given. Soft spin is given. Please note this. First, a soft spin is given. So what happens is, when a soft spin is given, the platelets do not settle down along with the Buffy coat. Instead, they remain suspended in the plasma. So your plasma becomes rich in platelets. Okay. So now you got your plasma which is rich in platelet. Now this undergoes hard spin. Now this when undergoes hard spin, your platelets are settled at the bottom. They are separated and your plasma is taken from the above. The lower settled layer is of platelet. This forms your PRP platelet. Okay, PRP-PC. PRP platelet concentrate. Okay, now coming to Buffy coat. In Buffy coat, what we do? The whole blood. We first subject this whole blood to hard spin. So your platelet is settled along with the Buffy coat. Now here after hard spin, you have collected the Buffy coat along with some amount of plasma. Now this is again subjected to a soft spin. So when you do soft spin, the platelets which was present here, they come suspended into this plasma. So now when you are removing the upper layer, you are removing the platelets along with the slight amount of plasma that you had, and your this settled layer is of the Buffy coat which remains inside your this actual bag. So here the platelet that you get is your BCPC, Buffy coat platelet concentrate. Okay, so these are the two ways in which platelets are formed. This you have to remember, where the hard spin is given and where is the soft spin given. Right? So now we know everything about the platelets. Now coming to the granulocytes. So I will tell very little, we'll not go into the details of granulocyte. You have seen that Buffy coat here is formed. The whole blood is subjected to hard spin and Buffy coat can be separated. This Buffy coat several buffy coats can be pooled together to form one unit of buffy coat. That is one way. This buffy coat contains granulocytes which can be transfused as it is, or it can be derived by a process called granulocytopheresis, in which granulocytes are directly derived from the donor, directly derived from donors by the apheresis process, right? So this is all that you need to know about granulocytes. We will not go into the details. Coming to the next product, which is plasma. Now, you know that plasma was the lightest product, and forming the uppermost layer, plasma is derived. Now, what happens is this plasma needs to be frozen within 8 hours of phlebotomy, within 8 hours of blood collection. Okay, so once this is frozen within 8 hours of plasma, this is called as fresh frozen plasma, right? If at all this plasma from the point of collection to the point of processing, if the time elapsed is 8 to 24 hours, this becomes your PF24, plasma frozen within 24 hours of collection, PF24. So what is the difference between FFP and PF24? Why will this happen? Why? See, this can happen because due to some logistic problems, or because of transportation from the site of collection to the site of processing. It may take more than 8 hours to travel and transport the whole blood from there to the point of processing. If that happens, this becomes your PF24. What is the difference between FFP and PF24? They are practically the same, only there is reduced amount of factor 5, factor 8 and protein C in your PF24. Okay, so now these are the two types. If it is frozen within 8 hours, it is fresh frozen plasma. If from 8 to 24 hours, it becomes PF24. Now they are stored, and now when it has to be used, they are thawed. How are they thawed? They are usually thawed using a water bath at 37 degrees centigrade. Now once it has been thawed, it is issued for the patient. Now let's say that this plasma, it was thawed, your FFP or your PF24, it was thawed but was not issued for the patient for more than 24 hours. Now this becomes your thawed plasma. This becomes your thawed plasma. Thawed plasma can be kept for further 4 days if kept at 1 to 6 degree centigrades. It can be used for additional 4 days if kept at 1 to 6 degree centigrades. It has not to be frozen again, right? So this will be your thawed plasma. Again, it will have your the factors which are stable. The stable factor 2 and fibrinogen can be in the usual amounts, but the other heat labile factors are going to be reduced. This you have to remember. Okay, once the plasma is thawed, the heat labile factors are reduced in their concentration in this, right? So now we know all the three types of plasma that is required. We know the FFP, we know PF24, and if both of them are thawed for more than 24 hours, it becomes the thawed plasma. Right? Now coming to next, which is cryoprecipitate. Cryoprecipitate. Now what happens is when you keep your FFP, now you have to keep your FFP for at least 24 to 48 hours, and then you again spin it. How do you spin it? You thaw it down to just 4 degrees centigrade, not more than that, and then you give a hard spin to it again. So what happens is a precipitate like substance forms below, and a liquid part is separated above. So this liquid part above is your cryopoor plasma, while the precipitate like substance which is formed, it is called as cryoprecipitate. Now your cryoprecipitate, you know, cryo means cold. So your cryoprecipitate is going to contain all the heat labile factors. So what does it contains primarily? It contains factor 8. It contains fibrinogen, von Willebrand factor, and fibronectin. So if asked, these are the four components of cryoprecipitate, and whatever else is left is present in your cryopoor plasma, right? So you have two more. Now we have seen all of the plasma products. Now let's see how are they stored and what are their shelf life. So firstly, shelf life. So shelf life of all plasma products is 1 year if kept at more than, less than 30 degrees centigrades. Lower than minus 30 degrees centigrades, the shelf life will be 1 year. Okay. Now storage temperature. Storage temperature is anything less than minus 18 degrees centigrades. Okay, your fresh frozen plasma or your PF24, it has to be stored at minus 18 degrees centigrades or lower. And where it is stored? It is stored in your deep freezers. Now these deep freezers usually are of three temperature. They can be 20 degrees centigrades, minus 20 degrees centigrades, minus 40 degrees centigrades, or minus 80 degrees centigrades. Okay, either of them. So now that I have told you at what temperature this is stored, now let me ask you one question. The usual plastics that you store in your, even in your domestic refrigerators, if you're storing it in your freezers, you can see that sometimes they tear off. Okay, the plastic does not survive the cold temperature, right? So the plasma bags are specifically made with materials which can which are resistant to such high temperature. Okay. Now having said that, there is something called as glass transition temperature. What does glass transition temperature do? What is it? So as the name suggests, see, uh, you have your plastic bag. What happens is glass transition means the substance transforms into glass. It starts behaving like glass. Why? How will that happen? How will you know that it has happened? If you've ever seen an FFP in your blood bank, if you go and see, if if you see by any chance an FFP being dropped, it drops on the floor and it shatters like glass pieces. It becomes brittle like glass. Okay. So why does that happen? It happens because the material in which it has been stored, it has converted into a glass like structure. So what is the glass transition temperature of these plasma bags? It ranges from anywhere between minus 20 to minus 35 degrees centigrades. At this temperature, like whenever these bags are stored below these temperatures, they will start acting like glass, and if they fall on the floor, they will shatter like glass. Okay, so this is the golden question here that you have to remember. What is the glass transition temperature and why it is required? Okay, so now you know the types of plasma products, the constituents of plasma products, how it is stored and for how long it is stored, right? So now we have seen PRBC, we have seen platelets, and we have seen the plasma products also. Now there is one small thing that I need to tell you is let's start with platelets, right? So we saw that platelets are stored at room temperature and their shelf life is just 5 days. What can be the possible reason? The possible reason is platelets is again part of blood and blood is a very good culture medium. So bacterial growth is possible in this. See, this is at room temperature and it has blood. So bacterial growth can very easily occur here. Okay, that is why the shelf life is 5 days. So if kept for more than 5 days, there are chances of bacterial growth being present in the platelets, which if transfused to the patient can cause further bacterial infection in the patient also. So the component which is most susceptible to bacterial growth is your platelets. And why is that? It is because it is kept at room temperature. So this is another golden question which will be asked. They will ask which blood component causes the most blood transfusion reaction. Which blood component causes most transfusion reaction? Your answer is platelets, and I have told you why. Okay, now apart from this, it can happen in plasma also and it can happen in PRBC also, but it is highly unlikely because as I told you, PRBC, if you are storing at 4 degrees centigrade, the metabolism decreases too much. So the same is going to happen for the bacterial cells also. Their metabolism will be decreased and eventually they will die. And the same thing happens in plasma, but there is something called as cryophilic bacteria, a class of bacteria which can survive very cold temperature. So these bacteria, if present in plasma, they can lead to transfusion reactions. Okay, this you need to remember, cryophilic bacteria. Okay, now we have seen that uh, what are the storage temperatures, what are the shelf life, and the two most common questions that can be asked from this. Okay, now why blood component separation is required? It is required so that if a patient is in need of only one component, only that component is given to the patient, right? So if the patient's hemoglobin is decreased, only PRBC is required. If platelets are decreased, like in cases of dengue or other viral infections, only platelets can be given. Or if the patient is having any kind of coagulation disorder, then plasma or other plasma products can be transfused to the patients. So this is primarily the basic things that you need to know about blood components. We have seen what are the types of blood components, how are they stored and where are they used. So this is a very basic class of blood components, but many questions can come from this topic. So before we wind up, let's just tabulate it so that you know which. This is the table that you have to always remember in this topic. So the blood component that we have, the storage temperature and the shelf life, right? So for PRBC, we know the storage temperature is 4 degrees centigrade and the shelf life is again 21 days or 35 days or 42 days depending upon the uh, additive solution. The next is your platelets. We have seen the storage temperature is 20 to 24 degrees centigrades and the shelf life is 5 days. And for plasma products, it is storage temperature is anything below minus 18 degrees centigrades and the shelf life is 1 year. So this is the table that summarizes your entire class. I have told you the reasons that correspond to all of this. This is the table that you have to memorize and you have to remember for your exams. Okay, thank you.